the Polk County Health Services Board to order. Roll call, please.
Francis Duncanson,
Here.
John Bonaprise,
Here.
Brett Wilson,
Here.
Pam Garvey,
Here.
Tony Johnson,
Here.
William Oliva,
Here.
Dave McKee,
Here.
Amy DePici,
Here.
Dr. Rebecca Lyman.
Here. Okay. And with that, we'll move on for approval of the agenda.
I move to approve the agenda as presented.
I'll second it.
Okay, motion's been made and seconded to approve the agenda. Any discussion? With that, I'll call for a vote. All in favor, respond aye.
Aye.
Opposed, same sign. Number 4, approval of minutes for the September 9th, 2025 meeting. Is there a motion to approve the minutes? Move to approve.
Second.
Yeah, motion's been made and seconded to approve the minutes for the September 9th. Any discussion? Nope. So with that, I'll call for a vote. All in favor, respond aye.
Aye.
Opposed, same sign. Motion's carried. Okay. Number 5, public comment. 3 minutes, not to exceed 30 minutes total. Do we have any members of the public, either in person or online, to make public comments? Does not appear so. So with that, I will close the public comment portion of the meeting. Item number 6, receipt of information from supervisors not seated as committee members. We don't have anybody here in person. I can't tell if we have anybody online or not. I can't see that far. Doesn't appear that there is any. So with that, we will move on to item number 7 for our discussion and review of the public nuisance ordinance red line version. And we have a pretty full agenda today. So we're going to try to limit this discussion to 30 minutes to remain productive and to avoid repetition.
If it's okay, I would like to provide a little bit of a history of the ordinances with the county. I think it will help to provide some clarity of the confusion that we've had with the human health hazard and the nuisance ordinances that we'll be talking about today. And then we'll go into those red line discussions. All right, so the history of the ordinances, for our purposes in the Community Services Division, all of them live in the health departments. We've got the 3, 1993, 2010, 2010 are all around clean air, smoke-free air ordinances. They've been revisions all along from the original one, clean air in 1993. The last one in 2020 was an update amended to add in the electronic delivery devices, so basically vaping devices. 2002, we had the environmental health and sanitation. That's our permitting, licensing of campgrounds, VRBOs, and that type of thing. We are not discussing any of those at this time, but they are part of that Chapter 16 that is in the new codification code process that we are using now as a countywide. What we're interested in is the 1983 nuisance disorder, as well as the 2000 human health hazard. I'm not going to read this to you, but this is the language from those old ordinances that if you have the old paper copies, which I do, if anybody wants to read them, we've got the old typewritten ones and they're like pieces of history now. So if you recall, Brian Hobbs has come to this committee or maybe even county board on several occasions and talked about, back in 1983, there wasn't a human health hazard. They wrote the nuisance ordinance to as kind of like the precursor to the human health hazard. Then come along in 2000, human health hazard was written and they kind of collided with each other. We've talked about updating human health hazard for quite a while. And then in 2020, the county took on that codification project where to make it easier for the public to look up ordinances, I think they contracted with a Muni code to be able to create the comprehensive ordinance library. So they just go to the website, look up the ordinance that they want. So with that, it looks a little bit different. You don't get the old typewritten ordinances that, were by year and printed out like it used to be. You kind of had to know what you were looking for back in the olden days. Now it's chapter 16, public and health and public welfare. So this is what it looks like. And through that process, they came up with chapters of those ordinances. So 16-1, that includes the definitions of what is in our health and public welfare as we know those old ordinances to be. 16-2 looks at the authority. And then 16.3 is that administration of those ordinances. And for our purposes, we're looking at 16-4. The nuisance part of it didn't even make it to the health and public welfare. That's down in chapter 22. And I believe that that is something that county board would want to discuss at a different time. It didn't make it to the health and public welfare section of the Muni code. And it's pretty vague language as it relates to how that company categorized it in this codification project. And we can discuss it, but that's how if that helps to clarify how we got to where we are today with old versus new and how we didn't arrange the chapters or anything like that. That was done through the Muni Code project. That makes sense. Any questions on that? So with that, we'll jump into public nuisances. Red line copies. So
I do have one quick question, though. You made the comment that you want the general board should remove section 2022. Is that kind of what you had just
chapter
said?
22.
Chapter 22?
Yep.
But that was kind of the whole purpose. I mean, that's what kind of you and Ms. McCurdy brought forward was to actually remove this. So but you're thinking that we'll do this part here. We already covered it in environmental services, and then we'll bring it all to the county board to remove the rest of it? Because I thought that's kind of what we were addressing.
Yeah, and I think probably through me looking at the Muni Code, this is the chapter 22, that
Yep.
original red line that we had gotten.
Yep.
It didn't even land in the public
Right, but
health and welfare section of our Muni Code. So it just made me think about, it's so vague in general on how they are wording it in the Muni Code. So I think it's definitely worth some exploration on the enforcement piece and like, what does that look like?
because but the original discussion was to remove this. And then,
It removed from our section.
no, we wanted to remove this completely. And because that's what brought my attention, like, we're not going to remove this language because I know you had said you didn't have enforcement and environmental services or, said, well, there's pieces that we really don't enforce. There are the pieces, there's crossovers. But that was, that's where it all started. So now you're thinking we would still leave this language in here?
If there are county board members who think it is still needed, I don't know if I'm the one to say that it should or shouldn't be there. I'm saying, I don't think it belongs in the health and public welfare.
Right. Well, but if I remember it, that the problem was you were getting calls based on this. And so you wanted this, and I think, environmental services was getting calls based on some of these, and they're like, well, they're kind of a mess. So can we am I not recalling this correctly?
Well, yeah, that's the crosswalking
Right,
of where it was linked back to, and boy, that was back in April. So let's refresh my
Right.
memory.
Us bringing it up as in, like, this is a concern that we're seeing, and then
Yes.
because it doesn't live in our like actual chapter, then we were just kind of like raising it up as we're concerned about this, but ultimately it's not in our purview. So raise it up. It's
Because I know I flagged it because before we removed this language, I want to make sure some of this language that was in here was addressed. Because I was understanding it that it was going to be a total removal. So, and I don't want to totally take this conversation sideways. I just wanted to clarify because it confused me a bit.
And I think that's where it has evolved in this process.
Sure.
That we have, from April until now. So it has evolved for us and digging in statute and looking at other counties and their processes. So we just want to make sure that it's
Right. You want to clean up yours and whatever we do with that,
correct.
let it do whatever with that. Got it. Thank you.
Supervisor Olson has a question, Chair.
So,
Sure.
yeah, no, I'm agreeing with everything Pam said, because my thought is at the start of this was about getting rid of it, not getting rid of it necessarily in this committee, but getting rid of section 22 between this committee and environmental services,
Right.
because everything on this originally was pointed to zoning, land and water, health and human services, whatever it was. So, I mean, we're covering everything in 2022-1 in chapter 16 that relates to this committee.
Human health hazard.
Yes.
Correct.
So I'm going to assume that anything that belonged at environmental services was taken care of on that side of things that was in here. So I mean, at the end of the day, I see no reason to have section 22 when it's all said and done.
That was
They're
kind of the
doing,
overall goal.
they're doing the exact same thing.
Right, 22 overlaps in both areas, so we're just making sure that it's covered in both areas and
Yep.
get rid of 22.
All right, if you guys are okay with that, then.
Yeah, no, thank you. And I'm sorry, I wasn't trying to derail the conversation. I just,
All right, so does anybody have questions on this April crosswalk? I believe that's what the committee said last month, is that we would bring this forward and offer the opportunity to ask questions. I know Supervisor Olson, I watched the video. You said you had a couple of things that you thought needed to be mentioned.
No, I don't know. I mean, if
Pulls
you
forward.
look at, okay, number 7 in 22-1, the accumulation of debris. I believe if I find it somewhere, it's too vague, is what it at one time said to cover it. And yet, when we put it in 11 now, in, where am I, 16-4-11, you know, some of those same wording is there, and just wondering how, if that wording was a little bit too vague in 22, how it isn't too vague in 16.
Okay, so Helen, if I get this wrong, I think what they added was that if it allows for the accumulation of flies, mosquitoes, disease-carrying insects, rats, or other vermin are allowed to breed, live, nest, or seek shelter, including stagnant water and/or solid waste. So it's not just that you have a pile of debris laying there, but if it's allowing for that to happen, then it is going to be an issue, correct?
correct.
Okay.
I think it's definitely more specific.
Mhm.
Number 11 is definitely more specific than number 7.
Okay.
Did you have another one?
Did I? Not necessarily, but that's a crossover from 22. I got a couple questions. Just on the red line version, I'll say.
So how, Chair Duncanson, how do you want to tackle this? Do you want us to go through each of the red lines? What we did with this was, if it's underlined, it's something that was added for clarification. If there's a parentheses behind it, or if there's a strike through, it means that it was either a word that was changed. If it's in parentheses, or a strike through obviously means that we struck it and added language for clarity. So if you want us to go through and explain, we can do that. We have 15-ish minutes to do so. Otherwise, do you want to just do Q&A?
So it's,
I can make my question very short.
Let Fran answer first.
yes, please, thank you. So it is kind of a big beast and a big animal, and I think maybe the best way to do it is we'll do it page by page. Start out with 16.1 definitions. Does anybody have anything there that they want to talk about? If not, we'll move on to the next page until we get the whole thing covered. Seems like a sequential, logical way to do it. So if we want to start with section 16-1, which is definitions. We can see our strike through and our red line. Is there anybody who has anything there that they have questions about or they would like changed? Supervisor Olson.
Just two things. I'm assuming you agree with like the definition of a human health hazard. And then, determined by the health officer or their designee. Was that in the old language in like, okay.
In the definition of human health hazard?
No, just, I mean, all I'm saying is because it's here and it's state statute. We have the right definition for a human health hazard. But then also my question was, I guess, under immediate human health hazard, in the old language, was that the last little bit determined by the health officer or their designee, that was in the old language as well? Or is that an addition to this? So in let's say the old 16.1, that it stands today
The old human health hazard?
was determined by the health officer or their designee. Was that in, I'll say today's language?
It's new language. Anything in red is new language, right?
Everything in red is new?
Red is new and
Okay.
The definition of immediate human health hazard is not in the current. So that definition
Was that?
is added, the
Okay.
entire.
There's the. That's the.
okay, so that would be an addition. Are there any questions on that portion of it? Doesn't appear to be. So then, as we move on down through the other definitions, are there any questions or comments or regarding any of those? I'll give everybody a minute if they want to review it again. Mr. Leva.
Madam Chair, but just a quick question. On the items that were written in red, are most of those based on state statute definitions?
That is a good question, and I believe the answer is yes.
Okay, then my next question is, has any other of this language been taken out of any other county ordinances for health and human services? As a reference.
I believe that there were other county ordinances that were reviewed as part of this process. Do you want to comment on that, Pam or Helen?
I mean, Helen did most of the work, so I.
Say the whole like western region of Wisconsin, I went through their ordinances and checked. And I think the ones I selected are, you could likely find throughout multiple counties. So I couldn't like pinpoint it. It was exactly just this county. I think it's a compilation, a lot of similarities across many counties.
So not doing a pun here, but you're basically standing on solid ground.
Yeah, there's no need to reinvent the wheel.
Correct.
We also wanted to consider the work that we did with Supervisor Garvey to make sure that what her concerns were also incorporated, because there are a lot of different variations also. If there's 72 counties, there's 72 counties, right? So Helen did a good job of scrubbing and making sure that the language made sense for Polk County.
Yeah, well, I would take it for granted that Councilor Leoso would know this better than anybody. If there are 72 counties and there are 72 ordinances, how many court cases have come up regarding challenges to those health and human services and whether or not they have been won or lost based on wording from those county ordinances? So if we're standing on solid ground, I hate to put you in on on the spot, Joe, but I'm just looking at that from a standpoint that if we're standing on solid ground, then basically there's no argument. I mean, there's a
Yeah, I would
discussion,
agree.
but there's no argument as to what the work that you guys have done. And we're on pretty good structure here.
What I can say is that Polk County's human health hazard has not been challenged. I don't know whether other counties' human health hazards ordinances have been challenged. If they continue to be in existence, my guess is that they, even if they have been challenged, have withstood that challenge. Otherwise, they would have been modified. So I don't know off the top of my head whether or not they've been challenged in this region and what those challenges were, but I can certainly look into that. And then if we have this as a topic next meeting, I can address that.
And you don't have to do that. I'm just looking at it from the standpoint that I think this has been pretty thorough and if Supervisor Garvey and Supervisor Olson are satisfied with the wording, and I think we're in good shape.
And we did have the Corporation Counsel's office review this red line and they didn't see any major issues with it, correct?
So kind of what I'm hearing then is on our definition section, provided we have no more questions or comments from anybody, we're ready to move on to our next section. Okay, so our next section would be Article 2, Human Health Hazard, starting with 16.2. There's not a lot of red line on this page. It's namely Section B under 16.2.
So the easy explanation of this is that if city, village, or town has their own ordinance, we're going to honor that and we won't step in.
And that, again, is something that I think is pretty tried and true and standard. Under the administration, again, just a couple of words of the or designee. Alrighty, so no questions on that. I think we're ready to move on. Look at us, just going right through this. 16.4, the human health hazards. We have a few more red lines on that one. I'll give everybody a minute if they want to take a look at that. I see under C number 2 references the EPA and the DNR and OSHA. I see section 6 has been struck. And then 6 is manure and fecal matter.
I just have a
Pam?
question. So I'm just, in reading through the air pollution one, and I know we talked about this back when we met about it, I do like the quantities as found in EPA. I like that because that's absolutely state, I mean, those are regulations we all have to live by.
Mhm.
I'm just curious, is that, do we have to have the rest of the language? Can we end it at regulations and standards, or do we have to have in such quantities of a duration that tends to or potential, I mean, basically, air pollution is if they've, if they're over the quantities of those. Is that, I'm just curious if that's not enough, or is there a need to have the rest of the language? And I know the rest of the language was not new, so we've kind of put the, EPA stuff ahead of it. But that was just something that just as reading it, because it's just, to me, for me personally, it just seemed to complicate it a bit. But that's just me. And I know we talked about it, so I'm not trying to blow anybody up, but just in rereading, it's like, is that enough to just end there?
So when I look at number 2, by as you suggested, perhaps cutting it off, to have it cut off, if the average person reads this, do they have any idea at all what the EPA and the DNR and OSHA regulations and it's just what are those things? What do they refer to? And I feel like those words, the rest of that language adds a little bit of clarification for the average person looking at it to know what the DNR and OSHA and EPA, what kind of things that they cover. Or my 2 cents worth. And I don't know how anyone else
I agree.
has any comments on that.
Yeah, I'm not disagreeing. I would simply say that, once we go to harmful for commercial or recreational use, that's pretty wide open. That's gonna have a different meaning for realistically probably everybody in this room. So it really leaves it wide open as to what that is.
I guess yeah, Mr. Loso.
So what I would say is all the language after the kind of organizations that are providing the standards is limiting it in scope as to what it's going to be applied to. So if you were to say the presence in the air of one or more contaminants in such quantities as these organizations say is problematic, what if it's happening out in the middle of nowhere where it affects no one? Are we saying that we are going to enforce something that's out away from everyone, that's not causing any harm, arguably, to anyone within the county? Simply because for a fraction of a second, it went above the amount of whatever air pollution, carbon, I don't know what air pollutions are. But it went above some parameter for a split second that harms no one, that did, so technically that's a violation. By having the additional language, it restricts it to, okay, it was a very short period of time, therefore the duration is the limiting factor. Well, it went above for a longer period of time, but it didn't actually impact any commercial use within the county, therefore it doesn't violate. Or it went above that amount of pollution and it was for a long period of time, but it didn't impact any animals or plant life or birds. It's a limiting factor. It limits the authority of the health officer to enforce that particular section. It's not granting additional powers. It's really restricting it more than anything.
Okay. And in all fairness, all these are measurable standards. So it has to be enough that you can be able to measure it. So, okay, thank you. Like I said, to me, it's continued to a little bit what Brad said, opened up, but that makes a ton of sense. Thank you, Corporate Counsel.
Okay, then we have a consensus there. We'll move on to number 6. Any questions there? Number 9. Again, that references a statute. So that's basically what we're looking at. Number 10, we're striking some language there. Number 11, we're talking about vermin and insects. Yikes. Okay. Then we have the addition of, on number 11, of solid waste, the structures, the flies, mosquitoes. I'm not going to go and read through the whole thing here. Number 12, we have wastewater. You have a question, Pam?
I just have more of a comment because some of this was some of my concern early on. And yes, I fully honest that I do look through things through an agricultural lens.
Mhm.
And when we came to this and I talked about, actually you get to the fall or you get to the dog days of August or whatever, you're going to have flies around manure pits. But what we talked about was then we referred back to the manure, and as long as it was, we have to prove it's improperly handled. And so I just kind of wanted to just highlight that was one of my concerns, and that's how we came back around and said, hey, if we have, the word improperly was added multiple times in here, and I really appreciated that and the work with the committee to do that. So that kind of, and I just kind of wanted to go on record saying that I get we're still going to have flies, but this is more about issues around homes, around daycares or whatever, that we've kind of addressed my core concerns in these two different pieces. So I just kind of wanted to highlight
I
that.
might have misread improperly or inadequately on that.
No, that's okay. I'm just, like I said,
Add that in for that reason.
sure. I just wanted to highlight that was part of the concerns that we're doing this and that we did get that language, that it's about doing things improperly. So.
I think everybody is on board consensus with that. We have wastewater. if we want to move on to the next page, private sewage systems, wastewater sewage effluent, applicable county and state codes, which of course, you know, any municipal or lake district, sanitary districts or anything have to abide by, you know, all of the state codes when it comes to that. So we've done pretty good. Do we want to quit here for today, or let's look at 16.5? Do we maybe want to cover that as well, as long as we're on a roll here, and maybe we'll quit after
Are you
16.5?
timing it?
Yeah, I'm just looking at the clock behind you. So let's take a look at 16.5, and then maybe for today, this is the most we'll digest, and we will have it on the agenda again next month and move on from there. So 16.5, housings as a human health officer, or excuse me, as a human health hazard. We can take a look at, it looks really number 4 is,
Well, there were 2 items removed. And they were interesting items that were removed. I don't know if you could speak to those, really hard to measure, like low temperatures and windows, quality of windows and things. So
Up at the top under A, do we, after health officer, do we need the word he in parentheses?
that we removed he because it said he before. So we just said the health officer.
That was removed.
Okay, so that should be.
Yeah. Brought it up to speed a little bit.
yes, Dr. Lemon.
You also removed a dwelling that is not free of accumulation of solid waste, that sentence. Do you know, why was that one removed?
I believe we removed it because it is also covered in earlier, the one we just talked about.
Okay, perfect.
So we didn't want to be redundant or duplicative. I just stated. So everything from the previous page just applies to a home.
That makes perfect sense. I see, anybody have any comments on that before we take a look at the next thing? So, looks like we have the word condemned just replaced by the word deemed. Is that, because condemned may have a legal inference? Joe?
I think from our perspective, we removed condemned, or we changed it because the word condemned has a different meaning to the public. Sometimes they think we're going to go and condemn the building and that means we're going to tear it down and all those other pieces. Versus we're just deeming it unfit for human habitation, and that's a whole nother piece.
Okay. Okay, that makes perfect sense.
And then the definition of that exact language is in our definitions then. So unfit for human habitation, occupancy, or use refers to a dwelling, et cetera. So that we have taken out condemned, specifically define a set of words into the ordinance so that people can say, I don't know what that means. Okay, well, it's in there.
Refers back to that. Okay. Then also we have provisions for anybody so they can have their due process in a hearing for the board. It looks like that wraps up 16.5. So let's quit there for today. And next month we'll start off with 16.6 and move on from there. 22.1 we'll want to cover too. Make sure everybody's on the same page with that. Yes,
Madam Chair, I just want to make one side note.
yes.
It's interesting, about 6 weeks ago, the Balsam Lake weed cutter broke down in the mill pond. And the reason it broke down was it sprung a leak. And the leak that it sprung was all of the vegetable oil that is used inside the weed cutter. And it sprayed vegetable oil all over the mill pond. And it was an interesting situation because a resident of the mill pond called the sheriff's department. And sheriff's deputy showed up. And then the sheriff's deputy called the municipal officer, Eric Jorgensen at Balsam Lake, and then he showed up. And Eric called the warden, and one of the wardens showed up. And it was interesting because they were trying to figure out who was liable, what was liable, and if it was considered to be a public hazard. And it's not. because it's biodegradable.
And you can eat it. I mean,
Correct.
you know, I mean,
But it was interesting because I don't see vegetable oil in there and I. Where'd it go?
yeah,
That's what ends up happening when you're looking at environmental services.
Yeah. yeah, people pay attention to everything.
That's
You
correct.
know, something that happens. So that's interesting. Thanks, Phil, for letting us know about that.
Similarly, on that topic, Fran, if I
Yes, please.
our ordinance is one mechanism by which these things can be enforced. The health officer within the county has the authority to enforce the state statutes. So these are additional things that Polk County has put into place that are specific to what Polk County wants to make sure are enforced and have a mechanism outside of the state statutes, but rather our citation and the enforcement section, which we haven't gone through yet. So we have other mechanisms by which a lot of these things can be enforced. They have definitions with statutes. And then as Mr. Oliva pointed out, there are other enforcement agencies that have other statutes and other regulations that restrict a lot of these things as well. So, and then there are also the towns that have their potential health officers that have their ordinances that they can enforce as well. And that's, again, one of the things that was changed here is any municipality that has their own health officer and that has their own health ordinances has the authority to enforce theirs within their section. And the county basically is going to say, if you adopt the language that's being proposed by community services, the community services division, we're saying if you have your own health officer, you have every right to enforce your ordinances. You're a smaller municipality. You have more control over your particular section. And if you want to enforce those the way you want to enforce them, then we're going to allow you to do that. Like I said, the public health officer still has statutory authority to enforce major issues, but the county ordinances, if you adopt the language as it is, basically says we're going to be hands off in these smaller areas that want to have their own self-control.
And I'm sure they appreciate the county's respect of that as well.
Right.
Okay, then, so that will cover item number 7 for today. Item number 8 is the review of the 2026 budget.
Madam Chair. Good morning, everyone.
Morning.
This will be a review over the budget that was presented in September and also what was given to the other committees so far. Here we are in October. Can committees consider any budget specifics under next slide. This is an overall look at the budget. Again, 26 versus 2025, $73 million budget for expenditure, total budget. Our levy is at 23.6, up from 23.2. Sales tax, we're keeping flat again as we look at that, as we see monitor sales tax. Proposed budget drops the levy or the mill rate 17 cents from 2025, from 267 to 250. Our FTE count goes up slightly by 2, and that's for the two positions from CSD that are state contracted, funded by that. So next slide.
Supervisor Olson, you have a question on it?
Just on the mill rate, dropping the 0.17. So how far, what's the max mill rate? If we were if we were charging the full mill rate, what would it be?
Don, could you answer that?
Rate is just the overall valuation of county properties
Yep.
divided by, so there's no maximum or minimum. It just floats with, the valuation the state provides us and then what we're doing in terms of levy. So there's not really a maximum.
So we have to set our mill rate, which
Well, it's actually set, that's
we
just.
set our mill rate according to what the number is that.
With our budget.
The mill rate is set by what we have in that levy line and the
Yep.
valuation from the state.
Yep.
This again is another overview of the budget. Levy up slightly, mill rate declines. our 2026 FTE compares to 2025. The proposed budget I have is, it allows us to invest in our priorities. It keeps our CIP moving. It keeps our employees and benefits package moving. Keeps everything going that the county board can continue on with their priorities. Next slide. Our general fund our general fund balance right now. Right now we have committed in the budget currently is $1 million to move forward some of the recycling stuff to complete that project. There's 7 million available still on that. It came out of committee to look at advancing the Justice Center project. That's the HVAC project there. Right now in the budget currently is $950,000 for that project. One of the things that came out was to advance that and draw another 1.2 million out of our general fund, which is a good idea to maintain that in a so we don't deplete our savings, but we still manage both our general fund and our levy and keeping that stable. Next slide. Capital improvements through 2024, most of our CIP was funded through our ARPA projects, COVID money. We restarted our debt program in 2025. That's borrowing or bonding with the levy to keep it stable. Budget I have in front of the board right now uses 3 different mechanisms. Our general fund, again, drawing that down, maintaining that properly, using the PTAG allocations for a couple pieces of equipment for parks, portion of the recycling special charge, moving that forward to complete that project next year with all the equipment inside, and then debt financing, the borrowing of $2.2 million to keep our levy stable. And that's using all this. We're still favorable, and our bonding rate is around 4.5. Borrowing keeps the levy stable, as I said, and we still maintain the majority of our general fund for keeping our interest rate stable and being able to pivot in case of emergencies or something happens. Yes.
So, and we had discussed this, I said on environmental services, and we had discussed some of this environmental services, trying to totally understand as minimal, knowing a little bit that we do, that because it was explained that we needed to keep the debt borrowing in order to have that ability to have the levy, that we can't, if we pay down too much debt, then it affects our levy calculation, correct? So how were we able then, but we say restarted the debt program, so did ARPA suddenly throw all those rules out the door for a while, so we didn't borrow during ARPA?
We had a larger capacity that we were in debt at that point because of the program for the Justice Center, so our debt payments were still moving forward at that same rate.
All right, thank you.
Now that we pay that off.
Yep, okay, thank you.
Next slide. And this is our CIP 5-year summary, where we have IT vehicles, other equipment, road construction projects, facilities, parks and museums, $7.5 million for 2026. You see 7.7 in 2027, moving outwards for that. So next slide. Additional funding requests. These went through all the committees last month. They have not changed. From the cell phones, the parks, the seasonal staff for parks going from 1.25 to 0.50. The information technology risk assessment funding, that's cybersecurity, ERC transportation coordinator, went back to the budget, total $165K. Next slide. These are our capital AFRs that include the courtroom again, the HVAC, then shows the recycling equipment that's being moved forward to complete that with the glass breaker, the sort line, the conveyors, recycling truck, more bins, the 9 squads for law enforcement, resurfacing the jail, as you recall, resurface the jail showers, as you recall. They have a mold issue over there. They always get hit on that, and that'll take care of that problem in the jail. Side by side for parks and County Road I for highway.
Supervisor Olson?
Yes.
Question on the bottom of facilities on recarpeting the child support area. At last month's county board meeting, it was discussed that there was going to be potentially enough money left over there to recarpet the district attorney's office as well. So I guess my question is if that budget is off of 45,000, 15, 20,000, pushing 50%. Are the rest of our bids, I hope, closer than 50% off? Because it seemed a little odd that we had budgeted twice as much money as we needed for recarpeting the child support area.
The rest of the numbers are solid. To my credit, what I should have labeled that as just carpet for the Justice Center, as all the carpet in the Justice Center is old, and this is a starting point of replacing that carpet. His initial bids do come in around that $45,000 mark. Not knowing where the final will land. If we do have extra over, we try to just move that money into the rest of the facility and continue on replacing the carpet in that facility. Next slide. This kind of goes to the next item on the agenda also. This was a couple things to move forward, $1.2 million from the general fund again to complete the Justice Center project. And then one other technical amendment came out of the district attorney's office, and that was changing the customer service rep from a 0.5 to a 0.75. I'm in favor of these two recommendations, as you'll see at the board for discussion next week. I have not had any technical amendments come out of the departments from CSD to this point. So that's my presentation if there's more questions.
Okay, thank you, Mo. Does anybody have anything they would like to further comment on or discuss? Or have a question for Mo on? I'm looking around. I don't see anybody. Okay. So with that, we'll move on to agenda item number 9, which is our technical amendments to the county
Is that
budget.
last slide?
Okay, that's what I was wondering. Okay, number 10, an update from our medical examiner.
Thank you, Madam Chair.
I always look forward to this because it is so interesting. It is. I mean, who knows what goes on behind the scenes.
All righty, good morning, everybody.
Good morning.
So what I have here is some updated medical examiner numbers, as well as some information regarding the unclaimed remains project. As of last week, these numbers were pulled from the 9th of October, so they are old as of a week ago. On November 9th, we have a tentative scheduling for final disposition for an urn of ashes with Polk County Chaplain at around the noon hour. One final push to get next of kin contact to pick up those cremains will be made. If we do not hear from them by 11/9, then the ashes will be spread at the cemetery. So as of last week, we have had a total of 103 medical examiner cases. These are in-person scene visits, not counting cremations or hospice deaths. Of those 103, we have 23 that have been signed out as accidental deaths. These include 9 ATV motor vehicle accidents and motorcycle crashes. We have 9 deaths that were certified as falls, complications of falls. So far this year, we have had 4 overdose toxicity deaths. No fentanyl trends with those. We're seeing a lot of methamphetamines as well as mixed drug overdoses. And we have had 1 exposure death due to our cold snap from early in January. We have had 5 suicides, 74 natural deaths, and currently we do have 1 pending cause of death. Autopsy was done early last week. We don't have the results of those yet. Of our 103, we have had 18 autopsy cases. We're noticing most of our autopsies are car crashes that involve other people and or charges pending. And then as of this time last year, we are in the same spot. So there have been no significant trends regarding caseload. So now that we're a little bit later into the year, I was able to pull some more numbers from 2024. We are noticing that the majority of our drug deaths have methamphetamine on board. All of our drug overdoses from 2024 have had methamphetamine, whether it's solo or with mixed drug overdoses. That's what we're noticing. So I kind of rocketed through those numbers. Does anyone have any questions for me?
Yes, John.
Of the 18 autopsies, were those all charged to the county or were they in insurance?
The 18 autopsies were charged to the counties, and when I say that they are 18 autopsies, I do have the ability to do toxicology testing on my own, as well as do external exams on my own. The autopsies are necessary for whether or not there's charges pending, other people involved in crashes, or in toxicology cases. The way that I categorize those to see if I need an autopsy or not is if the toxicology comes back negative, do I have a clear-cut cause of death? If the answer is no, they have to go for an exam. If the answer is yes, they have medical issues on board along with kind of a rule-out toxicology, then no, I feel comfortable not having to pay for an autopsy for that. So that's something that I will handle on my own.
So they were all charged to the county, no insurance or anything involved in any of them?
No insurance for, I mean, truly, I haven't had to bill insurance for autopsies because that is something that me as county medical examiner, I need that documentation to create a accurate death certificate. So that is something that we use to certify death.
I've also noticed just in going through insurance processes and evaluating insurances that from what I've seen, most of them don't cover an autopsy anyway. They exclude an autopsy from coverage. So, yeah, one of those things that's kind of fallen by the wayside, I guess. I have a question.
Yeah.
So of your review of the deaths in Polk County, would you, do you have any way to comment on what would be alcohol related?
Alcohol deaths are very difficult to determine because we have two different types of alcohol deaths. We have chronic use alcohol deaths where the subject may have been drinking for an extended amount of years or decades. And then at that point, alcohol consumption will turn into natural disease processes. And then we'll have kind of an acute toxicity, which is more of an accidental death. You know, think of the cases you hear about, you know, too much partying, something accidental aspiration of vomit. Those would be more considered accidental deaths. So with the natural deaths that come from heavy alcohol use, I will list alcohol consumption on the death certificate as a contributing factor, and all of that data does go to the state. So if it's something that I feel is contributory, you know, if it's the if not but for argument, if this person had not been chronically ingesting alcohol at a high rate, would they have developed liver disease, chronic kidney disease, heart disease? More often than not, I say no. So then I feel that those alcohol is contributory, and that is documented on the death certificate, whether it's in part 2 or not, and it's just on the document and the state holds those numbers.
What about accidents?
Accidental deaths, I will say, the only time that I will have a death certificate with an accidental death for alcohol consumption is a case of aspiration. Whereas, you know, someone is unable to be conscious and they accidentally vomit and they aspirate.
Do you mean
Or-
car accidents?
Yeah, I'm thinking.
Oh, sorry, I thought we were still on the alcohol. Accidents, we do run toxicology on our motor vehicle accidents. What we have noticed is the alcohol will still be listed on the death certificate. There's a drop down that says, was alcohol contributory? Yes, no, unknown. If someone has alcohol or any other substances in their system, I will list that on the death certificate as well. I believe last year we had a car accident towards the end of the year in December, and it was a car accident and the subject had metabolite of cocaine in their system. And so that was listed as part 2 in the death certificate, because if it's not supposed to be there, it's not supposed to be there. I think it's significant enough to be listed.
Probably was not prescribed that cocaine by a doctor.
I wouldn't assume. So there are ways within a death certificate to make sure that those little tidbits of information are logged. Because that's where our statistics come from. So if we have unclear death certificates, then we have generalized statistics, which does nobody any good. Which is
Interesting.
why I will call for autopsies in cases that I need an extra little bit of help for the documentation from a forensic pathologist. But ultimately, in autopsy cases, they do not sign the death certificate. I still do based on their report.
Just on that same discussion, so if there was deaths of passengers, is the death, I mean, and the driver was drunk, the driver was high, whatever, is there any connection? Is there any reporting as far as they had died due to the car crash because of an impaired driver?
Very, very good question. My role is to certify cause and manner of death. Any of those legal at-fault determinations is done by law enforcement.
Okay.
So my role is to provide documentation that, yes, this person died from these injuries
Okay.
with or without items on board meaning toxicology. And usually in those types of cases, the main question I get asked is survivability. And that truly is something that I can't say yes or no on
Sure.
either. But any kind of fault, that's determined by law enforcement
Got it.
and the investigators.
So it's not on anything that's done on the death certificate. They died by being ejected from the car.
Yeah, so
Yes.
So on a death certificate, at the very bottom, was this death an injury? Injury meaning incident. That's usually the vernacular that's used. And then in the very bottom, there is a blurb where the certifier, myself or a doctor, would have to list how these injuries occurred.
Got it.
And so it might be a blurb where I say subject was stopped at a stop sign. He was rear-ended and pushed into oncoming traffic. So like it's a little bit of a sentence, but it's truly not a full-on report or narrative.
Thank you.
Yeah, of course.
So just for my clarification, when you were talking about like drug overdose deaths for like meth.
Yep.
The last couple of years, I believe you said like 100% of them have not had fentanyl.
No, I'm sorry, not 100%. I meant, so we have had in 2024, 2 deaths had fentanyl on board. With that being said, those 2 deaths also had methamphetamine on board. So those were considered mixed drug toxicities. But we did have a 55-year-old female who had methamphetamine, other mixed drugs, as well as fentanyl. And then we had an 18-year-old male who had methamphetamine on board with fentanyl and its metabolites. So that's, phenol, acetylfentanyl, those other metabolites that are present. As far as which drug caused death, it's very difficult to say. That would be a forensic toxicologist question. But for me, those deaths would be certified as accidental death due to mixed drug toxicity. And then in the part 2, that blurb that we talked about, I would say subject ingested methamphetamine and fentanyl. And that's how that death would be certified.
Okay.
Any others?
Do you have anything else to report for us? I didn't mean to cut you off on anything. So I just want to,
No,
I just want to make sure you covered everything you wanted to cover.
yeah, I have covered everything that I have. Our ability to transport on our own has been extremely successful. With the transport vehicle that has been kind of shared with the sheriff's office. So we were able to get a cot, and that has saved us some significant funds for transport fees. Because then we're able to do our own transports as well as maintain a chain of custody. So as far as successes, if there is a success in the medical examiner's office, I would say that that's been good.
I have a question. Are you able to work together with other counties that may have things available that we do not have here in Polk County? And I am thinking specifically of St. Croix County. I understand they have a type of a scanner that is pretty helpful in diagnosing or determining cause of death.
Yes, they have, it's a forensic CT scan, and it reads as a digitized autopsy report. However, that scan must be interpreted by a forensic radiologist. And with that being said, the cost of having it scanned and interpreted by a forensic radiologist comes out to the same cost. If I were to do my own toxicology testing, it comes out to the same cost roughly as a forensic autopsy. Truly, it is an amazing resource. We have utilized that for our Native American populations. Last year, we did have, or I believe 2 years ago, we had a death that needed to be investigated of someone from the Native American population whose family was objecting culturally to a forensic exam. And so in that circumstance, with the cost, I would feel comfortable using it. However, it's unclear if there's any, if there would be any problems with, processing those or prosecuting those types of cases, how those results would be interpreted in the future. So if it's something that we can just perform a forensic autopsy on, I will go the route of autopsy. If we have to spend the same amount of money, I would rather go the forensic autopsy route. However, it is a very good resources for cases where families object to an exam, and we can still give them answers.
Interesting. Yes.
In the case of the scan and the interpretation,
Mhm.
would those be covered by the patient's health insurance?
I don't believe so. It's something post-mortem that's being called for by my office so that I can have a cause of death. Actually, I would like to retract on my previous statement. We have had 2 deaths. There was a Hmong family that objected to an autopsy for a hospital death of a young male. And so we were able to do a forensic exam and find natural disease processes, heart disease, liver disease. And we were able to give the family some solid information that maybe we wouldn't have been able to give them had we not. Because unfortunately in Wisconsin, I cannot list natural causes on a death certificate. I have to have something. So if it was as simple as listing natural causes after we ruled out toxicology, then that would be fine. But to me personally, that's an inaccurate death certificate. That's very generalized.
And you can't do it in Wisconsin?
And I can't do it in Wisconsin. No. Wisconsin likes its data. Wisconsin likes its statistics. Yeah.
Well, thank you for your presentation and all your work and putting all of it together and explaining it to us. If I don't have any other questions, we'll move on then.
Okay, thank you.
Okay, so number 11 is our discussion and possible action regarding resolution 3025 to request funding and additional support from the state of Wisconsin to offset federal SNAP program changes. So we have the resolution in our packet. It's my understanding, I was just reading that with the federal government shutdown that SNAP is funded through the end of October 31st. And then after that is unknown at this point.
And share.
Quick and,
Yeah.
so that's unrelated to this. This has to do with the Big Beautiful Bill and the Medicaid impact. So it is the related to the additional workload that will be placed on economic support for the processing with the new work requirements, as well as going from 50% funding to 25% funding and the error rate, that 6% error rate penalty that we talked about. So at the end of the day, if we in our consortium are not within our 6%, that could be an additional cost to Polk County alone of $208,000. We do not want that. Consortium-wide, it would be $2.3 million. Potentially, right, Diana?
Yes.
So that is a pretty large impact. And I think the tri-chairs and the PACs are working on what that all means, because it's a statewide look back, but they're talking about drilling down and knowing what the specific consortium error rate is. So for example, if the state of Wisconsin error rate is 10%, we may, I think originally we would all be in the 10% bucket and paying that 10% rate, but now they're talking about drilling down on just consortium. So we really want to be up to speed on being under that 6%, so we don't have those sanctions against us. However, still a large amount of money if we're going from a 50% funding cost share with the state to a 75-25. So this is the county saying, yes, we fully support the state going forward and asking for that 50%, maintaining that funding model that we currently have.
Is this,
reason this is coming forward now is that there's a new budget correction bill going through right now. So they wanted to get this information from the counties so they can incorporate that in.
oh, will this also go to the county board?
Yes.
Okay. All right. Does anybody have any questions on the resolution? Pam?
Please do, because, so if I remember right, the consortium, your group, was like at a 1% error rate, wasn't it? Or I mean, they had a really, really good rate.
Yeah, we
Our
have
last-
maintained.
Off of our last management evaluation review from the feds. That was in June. Our error rate for our consortium was under 1%.
Okay, I was thinking it was really, really good, yes.
But statewide, as a state, we were still over the 6%.
Over the 6. So is the concern with the fact that the error rate will go up I mean, obviously you guys are doing a great job. So is the concern with the error rate going up because of the additional, now we have to make sure they're meeting the work requirement? Is that kind of the gist of why we're worried about the error rate going up?
The error rate is a moving target. They pull numbers every month for our error rate.
Sure.
So it's just gonna fluctuate from month to month.
It depends on new workers.
And we
Diana
have
just
our,
told me this government shutdown will affect our error rate because there's going to be some manual processes that may need to be put in place. That's opens us up for error right there.
and what we're trying to do locally at our consortium levels is we're basically taking an application for food share or renewal. And a worker has always been able just to confirm those benefits, assuming best intent and that correct benefits are going out. Moving forward, we're actually doing double duty. So we might have a worker that's going to do an application or a renewal. And before confirmation of benefits, depending on our target groups, we have earned income is a higher error rate for us. Shelter utility budgeting is another target area. So we have certain target areas that we're focusing on. And so when a worker does an application or renewal before confirmation, now we're asking another worker to go in on top of that case and basically review the whole case. So we are doubling our workload to try and support the state being under their 6% error rate. That's going to take more time, more staff, all of that we need to fund somehow.
Okay, and I was just thinking, if you've got it kind of down to a science, what has really changed? So it was the fact of the higher emphasis on different things, and because of that, then it's the double checking. That's, you know what I mean? It's like,
Yeah, it's a definite added workload. And then some of the things for food share in particular that are being implemented November 1st, our state's computer system is not ready.
okay,
So staff will have to be doing a lot of manual work on top of trying to then do the Medicaid and Badger Care programs as well. So there's just not enough. We need to make sure we got funding there to do what the feds are asking
I
us.
ask you to do, sure. All right, super, thank you.
Sounds good. With that, I'll entertain a motion to send this resolution to the county board with a positive or negative or no recommendation at all. So I'll make a motion to send resolution 30-25 to the county board of supervisors with a positive recommendation.
Second.
Okay, any discussion on that? No discussion. With that, I will call for a vote. All in favor, respond by saying aye.
Aye.
Opposed, same sign. And motion carries.
Can I just add a comment? I think this sometimes is really good for people to understand. So we, in Polk County alone, we have roughly $600,000 that comes into our county for food share per month. For 2024, we had just under $4.8 million of food share benefits brought into this county, which impacts our providers. So you're talking our grocers, you're talking Walmart's, marketplaces, Dick's Market. So the impacts that are being put on the food share program not only are going to have a huge impact to our consumers, and roughly we have a little over 4,000 consumers that benefit from food share here in Polk County. It's going to have a trickle-down effect that's going to have a larger impact as well on our vendors and our providers across our county. So I sometimes think that it's easy to really dismiss the importance of these programs and how they do impact not only our consumers, but the bigger picture as well.
As a whole, the economy.
So that's just my extra spiel.
Well, thank you for giving us that information. That's good to have a broader picture of that. Okay, and then moving on to agenda item number 12 is discussion regarding marketing and billboards. Supervisor Olson has requested
That's
this.
mine. So I'll pass these around just so people know what I'm talking about. There isn't enough for,
Okay.
there's like 7 of them, so there isn't enough to necessarily get around, but you can share them, see what it is that we have, just so that everybody knows what I'm talking about. So I'll wait till everybody gets one, I guess. Again, sitting on this committee and discussing, as we heard today, methamphetamines and illegal drugs within the county, within the state, within the nation, right? And to find out that we had county staff involved in putting up a billboard that, and Tanya, correct me if I'm wrong, but I believe in our discussion was somewhere in that $8,000 to $10,000 range of funds spent on this in one form or another. That in my mind, we're promoting drug use. I mean, you can say that you carry hope, that you're carrying Narcan, which I didn't even know what the brand, what the real name was there until I found out it was Narcan. But to think that as a government agency that supports, I would hope that we support law enforcement in this county, on this committee and on this county board, to think that we have men and women out there every day putting their lives on the line to take these things off the street to try to keep our population safe. And then find out that we have this type of money being spent within the county to, in my mind, nothing more than to promote drug use. I mean, at the end of the day, that should not say I carry hope. It should say I carry dope. It should not say I carry Narcan. It should say I carry death and destruction, because in my part of Polk County, at least, the individuals that I know that are hooked on drugs, they're not carrying hope. They're not carrying Narcan. They're carrying dope, and they're carrying death and destruction for themselves, as well as their family and their family units that go on at times for generations. And so I think, we made it very clear there to not put somebody's mugshot on there from somewhere in Polk County or the state of Wisconsin, because when I look at the internet, when I look at news, I do not necessarily see an individual that looks like that who's been arrested for drug use. And I think it is a shame and a miscarriage of justice for our county, or at the end of the day, any county, to be spending funds to do nothing more than to tell somebody and give them false hope that, hey, if you carry this shot with you, you can do illegal drugs safely. I don't believe there's a way to do illegal drugs safely. And I think for this county or any county to promote and say that, hey, we can help you do illegal drugs safely, I think we're doing a disservice to our public. So there's my soapbox speech.
So do we have, it's my understanding, and I could be mistaken, that's why I'm asking, is that this is grant funded? Or is this tax dollar funded, this billboard? So how is that funded?
I gave the information to Supervisor Olson. It was a grant from the Northwoods Coalition. 8.3 hours of staff time was funded by the grant. The billboard itself was funded by the grant, and about 1.5 hours was spent by our business services staff, which they don't get that granular in their time reporting. So I'm not sure that we could tell you exactly how much was actual levy county dollars, but there would be some in there. This Dose of Reality campaign is a campaign that is aimed at an evidence-based harm reduction program. So we felt that it was appropriate to support our prevention programming that we are in some areas required to do. It doesn't advertise that it's Polk County. It doesn't advertise that this man is a drug user. All it does is advertise that he carries naloxone. We don't know why he carries it, but it was a very specific campaign from the Northwoods Coalition. They do Dose of Reality. That's their main campaign. So that's what we did.
Does anybody else want to make any comments on this? Dr. Lyman?
But when I saw this billboard, I don't see this as the drug user. This is me. This is my husband, my kids carrying naloxone in case they come across someone who is unconscious. I would provide basic life support to any person I came across. And that's what I see in this poster. I did not see a drug user who is using drugs and carrying naloxone. I don't think they are.
No, they're not that forward thinking.
No.
Okay.
Yeah, so I was just wondering, who's this ad targeted towards? Is it, I mean, am I supposed to be carrying it? I mean, I can go to Walmart and buy it because I saw it on the shelf next to the finger splints, which makes no sense at all. And it's for $44.97 for two. So I don't know too many people that are just gonna go to Walmart, pick it up and carry it. So I was wondering who the ad was targeted towards. I talked to some of my friends that had seen this too, and they had no clue what Narcan was, what it was used for. Just didn't understand why, and that the people that did know what it was, they thought, well, does that mean that it's okay to do drugs as long as you got Narcan with you or your friends? Or I just didn't understand the ad at all. I think a better ad would be up there with the fentanyl kills, instead of condoning the use of drugs by carrying Narcan.
John?
I'm just speaking for the people that I represent, and I agree with Supervisor Olson 100%. I mean, I think a lot of people feel that we're advertising drugs by having Narcan as a prevention. And I remember when we had the old billboard, with somebody on the billboard that said alcohol kills and different things like that. That was a much more positive than here. Well, it's all right to do this because we do have something that is a prevention. I think you're 100% right, Supervisor Olson. That's the gist that I got from the people that I represent that have contacted me.
Pam?
So I've got a couple of statements with this, and personally, the whole concept really really unsettles me, because how many people and how much do we promote carry EpiPens? Those are, an anaphylactic reaction is deadly as well. But we don't promote and give away free EpiPens. So that's just one basic thing that really does bother me. Second of all, I've also heard well, we know what's out there. We're just trying to mediate it somehow. And on the way here, I'm like, I live on the Cut Across Road, so Highway 35 to Unity School. It's 45 miles an hour. No one drives 45 miles an hour on that road. So do we just put a sign, please stay under 70? Even though we know how many accidents have been on there, we know how many people, I live on there. I've seen plenty of accidents on that road, and it's a terrible road. It has no shoulders. I really, really struggle with the idea that we've used any taxpayer money, which includes grant money, to actually say it's okay. Because that truly does feel like the marketing piece on this, is that it's okay, that somebody is there to, and I am not about, every life has value. I'm not about not saving lives. That's not it. I don't have a problem with if we have law enforcement that carry Narcan when they walk into a situation or whoever. But the idea of out there promoting it or handing it out free or spending our taxpayer dollars that doesn't say this is dangerous, don't do it, bothers me.
Exactly. That's
So-
what public thinks.
I have what may be an unpopular comment. I respect we all have an opinion and a right to have our opinion. I guess I don't agree with the characterization that it promotes drug use. People who use drugs and addicts, they're going to do it whether they have Narcan or not. So it's, in my opinion, I think that everybody's life has value. I think their lives have value. I don't think they're disposable people in society. I think that there is hope. As far as having Narcan, I agree with Dr. Lyman. It's, if you come across someone, you would be able to help them.
Right.
But yeah, I don't agree with it personally that it promotes any kind of drug use at all. People start using drugs because for other factors. They don't start using drugs because they see a billboard on a highway. They start from a lot of different factors, which I'm not going to get into. So, that's just my 2 cents on it. I think we heard an inspirational story in Rice Lake when we had a local first responder from New Albern who had a drug problem and had recovered. And, I guess that's the way I look at it, and too, I'm going to go there. I'm going to say it. What would Jesus do? So that's personally the way I look at it.
Sure.
Joe.
I don't specifically know where the grant funding is coming from. However, I would highlight the fact that there is a substantial amount of opioid settlement money that has come into the state. My guess is that at least some of that is the funding that is funding this particular program. Opioids addiction, having gone to numerous trainings on the topic, are often a result of the pharmaceutical industry having allowed and pushed doctors to overprescribe opioids. So this isn't just your average methamphetamine user, marijuana smoker. This is family members that have had a critical injury and are now addicted to opioids. Oftentimes it starts with Oxycontin or whatever other opioids that is, and will transform into heroin. That isn't to discredit any argument that anyone who doesn't like this particular ad campaign or doesn't like the idea behind it. I just wanted to highlight that these are not likely to be general taxpayer funds. These are likely to be funds that are being brought into the state as a result of the pharmaceutical industry taking accountability for the fact that they caused this problem. And they're funds that are being distributed for the purpose of trying to reduce the harm as a result of that. So I think there is validity to everyone's opinion on both sides of the topic. However, I want to highlight the fact that that money is likely, at least currently, not coming from taxpayer funds.
Okay, thank you. Do we have anyone else who would like to make any comments? Rita?
That brings me to, what is the Northwoods Consortium?
Northwoods Coalition.
Northwoods
Yeah.
Coalition.
So it's out of Marshfield Clinic. It is a substance use coalition, reduction coalition, prevention coalition.
For the whole state or private?
In the Northwest region, we are a part of it through our drug-free communities grant. We participate in that.
Okay, so that's where
Mhm.
this whole idea.
Mhm.
I haven't seen this. Where is it?
Right by
They're on
Walmart.
Rice Lake.
Oh.
Oh, the billboard?
Billboard.
Straight south of here.
Yeah, it's on Highway 8 between just
You have to be
Yeah.
going west.
by 46 and going west.
Yeah.
65.
Okay, thank you.
40 to 46 is there.
Never go that way.
Okay.
Tony?
Is there any way to give them feedback, how we feel about their billboards?
The coalition or Joseph Reality campaign that state?
Well, the Dose Reality, the coalition and everybody that's, behind it, you put out an ad marketing. I think some people would like feedback. And it would be nice to give them,
I
as a
guess you
board,
could go to their
what we
website and
think.
give them a comment.
On
The
their
state.
website.
Sure.
I think
that's
that's
a
what's
good idea.
important to hear.
But I
And
guess,
their website's right there on the billboard.
but I think you're asking as a committee. As a committee, can we make a
Yeah,
comment?
yeah, yeah.
Not an individual, but
Not
as
an
a,
individual, but
a
as
Health
a
and Human
committee,
Services
how we
committee.
feel about the billboard being in our county, and then what we would like to see more of a billboard, maybe more prevention instead of a reaction or something like that, give them good feedback.
How about if we send out a link to the committee so they can provide feedback back to that link?
Yeah, I don't,
Okay with that.
Find a link.
It still would be from individuals.
Right, that would still be individual though.
yeah, I don't know. Yeah. I don't have a problem with that. I mean, I think that's a good idea.
But having an individual link, again, is still individuals versus if as a committee,
So-
we're saying that we want to address it.
So if I understand correctly, you want this committee to do a resolution or something and take a vote and send that to this coalition or send it to the county board?
I mean, Supervisor Johnson, I mean, because that's how I'm taking it from him as a committee to make a comment.
Maybe I can help here.
Sure.
So what if a resolution was drafted before next meeting or by our next meeting next month, and it'll be early next month, right? I mean, we're looking at 3 weeks instead of 4 weeks kind of, right? To get it done before the,
It has to be in by
Yep.
October 28th at 2:00.
yep, but it could come out of this committee at the next meeting and go to the board meeting, could it not? Because we're gonna don't we have to meet next month, like the first week of November?
Yes.
Everybody does, to be ahead of
Budget.
of county board budget meeting on the
And-
14th or whenever.
Right, it could, I'll make it in time for the county board on the 12th.
Yeah.
So
Okay.
this is
So what if we
like,
what if there was a resolution drafted to come to this committee and then go to the county board?
I'm
Could
kind
either
of,
be voted up or down at the county board level, and
Sure.
Would you draft that?
I'll draft it.
And then if we,
Could be voted up and down here too. I mean.
Well, right,
Yeah.
right, and it will be.
why don't we sign it individually? If you want to, we do. If some don't, they don't.
so I'm just thinking, haven't we kind of already done this? Hasn't the county board already kind of addressed, opioid test strips and that type of thing? And it's, I guess what I would term a feel-good resolution,
Oh.
even though it might not make anybody feel good, or it may make some people feel good, but it's not a resolution that is going to, it expresses an opinion. Well,
I would think this one would just be tailored specifically for feedback on the campaign that's in front of you. To provide feedback to a coalition on information.
That's our point.
Brett?
I would say if we get rid of our feel-good resolutions at the county level, we won't be voting on very many after this. I mean, we passed a lot of feel-good resolutions. I mean, at the end of the day, we passed one that has a huge financial impact on us 20 minutes ago, but it's also a little bit feel-good resolution. It makes us feel good about passing the resolution. I feel good about passing it, right?
So what's the result?
Provide feedback. That's what you're looking for, to
Yeah.
provide feedback to
And
the
then
campaign.
typically that's what feel-good resolutions are about, is about making your point known to somebody.
Right.
Typically the state of.
It's more your official reply back to them on what you think about the campaign. So
Thing is though, do we have consensus about what to put in that resolution? It doesn't sound like we do.
Well,
If I
Joe, yes.
This committee someone would have to move to direct me to draft a resolution. I can work with whomever. I can work with Supervisor Wilson or whoever wants to work on the potential drafting of that resolution. So this committee can direct me to draft a resolution for next meeting. Once the resolution is in front of you, you can then amend it, change it, or actually, because it would be supervisor-driven legislation, you would have to talk about amendments that you want to occur on that resolution. And then when you send it up to the county board, you make recommendations for what you want the county board to amend. That's how we have our rules of order drafted. It's not particularly conducive to creation of legislation, but that's how we have it. So this committee, someone would move to direct me to draft said resolution. It would come back next time if a majority of this committee agrees to do so. And then it would come back, you all discuss that particular resolution, what you like about it, what you don't like about it, and you again vote on whether to make a recommendation that that resolution pass at the county board level. That's the procedural.
I don't mean to argue with corporation counsel.
I
Sometimes
have
it's
some
fun.
questions.
Consider it's not an action item on this thing. I would rather have it by consensus that they direct me to dictate to corporation counsel to work with Supervisor Olson that way.
So I have a question, I guess, also. So this is on the agenda for discussion, and I think that's entirely appropriate. But our agendas are supposed to, according to the Attorney General's opinion on open meeting laws, are supposed to reasonably apprise the public of what we are discussing and any action that would be taken. Personally, I don't think that the way this is worded, I had no idea what it was about. I don't know if anybody else here feels that way. So I guess I have a question like, can we even take action on it? If we can, we can. But I have reservations that this is so vague.
So
On item 19.
So what I can say is, I think that you're right. There could be an argument that could be made that it could be a violation if you were to do any specific action. The safest way, if you wanted the absolute safest route, would be put it basically at
Number 19.
like Administrator Barbie points out on 19, and talk about putting it on the agenda next committee meeting. At the next meeting, have it on for discussion and action. And at the next meeting, then direct myself via our rules of order.
So is there any hurry or any rush that this has got to be done right now? Is there any urgency that, we maybe can take enough time to dot our i's and cross our t's and,
I have no opinion on the emergent situation.
Just one question, as we identify matters for next meeting, can it not just be identified as a resolution?
And then I could take correct. So ultimately, this committee doesn't have to take that action. That's one route. The other route is basically based upon this conversation and the general feeling that the administrator gets out of this conversation. The administrator can also direct me to draft the resolution. The chair of this committee can draft, the chair of the board can direct me to draft legislation based upon a conversation that they see at a committee. So there's lots of options for how a resolution can certainly be in front of this committee at the next meeting.
so it sounds like there's a path forward then to have a resolution drafted that is perfectly, legit without, raising any other issues. Yes, Mr. Andrew.
I'm not being negative, but it seems ironic that being on this committee for a number of years, I've listened to an awful lot of discussions on drug use, drug abuse, prevention and treatment. And yet this county was the only one out of 72 that didn't get an opioid settlement, which would have been worth millions of dollars to this county.
Yeah.
20 million.
Very fascinating. And then $8,000 is spent on what I think educationally is a very positive thing. For those people that don't know what Narcan is, apparently you don't listen to the media, you don't read, and you are not tuned in to health professionals. You need to know what it is. Every law enforcement officer uses it, carries it. If you're not aware of what it is, you're living under a rock. So I'll leave my comments there. And I know whatever resolution is drawn up, you're gonna have a split vote here.
Yeah.
I already know that.
Even school administrators have Narcan. Okay.
Absolutely.
Thank you, Bill, for your input. Do we have anybody else want to make any comments on this? Okay, looks like we will be addressing it on number 19. So moving on then, agenda item 13, Mo.
Yes, Madam Chair, just a couple updates. The rest committees, the Sheriff's Department at Homecoming beat the Unity kids in softball for the second year in a row.
Easy. I already got
Rub it in.
crap. I already got
They
crap
beat
this
those-
year.
They beat those kids. Sales tax for September was slightly up. As I stated, at other committees, moving into 2026, we'll be seeking a third judge for Polk County. So we're looking support from our legislators. There'll be, some resolutions coming forward on that. They are doing a caseload study right now. Currently, our judges have right about 600 open cases each right now. So, and that's well above what other neighboring counties have and other judges have. The WCA conference was good networking. Had great conversations with Supervisor Bonaprise and Kelly down there. Some good breakout sessions there. Tomorrow, the Environmental Services Committee is going on a forest tour at Summers Lake Recreation Area. So that starts at 9
Are the
o'clock
wood
leaving from
ticks
here.
still out?
What's that?
Are the wood ticks still out?
We'll go on the 16th.
Deer flies? Okay.
Are you wishing hateful things on us? Is that it?
No, I'm just thinking they'd be buzzing you is all.
The Sheriff's Department had 2 graduating from the Sheriff's Academy in Northwood Tech in September. And the grandstand project has started at the fairgrounds with concrete pouring and footings pouring. So looking forward to that project getting completed. Done. So that's my report. That's all I have right now.
Supervisor
So
Wilson.
sales tax, I mean, still up, but I mean, how much difference from like a month ago? We up or down from like a month ago, do you
It
know?
went up, our overall went down 3.3% over the year.
Okay.
So we're still up a couple 100,000, but can be wiped out in a month. So we're still kind of looking at that $5 million mark.
Okay.
Okay. Yes.
Anybody wants to read about our breakup sessions, they can have this book, and I brought a few extra back.
Oh.
Some good
Thank you, John.
information there as to what our breakup sessions consisted of. There was a lot of them. We just pick and choose which one we thought we could bring something back.
Okay.
It was the biggest conference we've ever had.
Yes.
All
Yes, very
72
good.
counties, all 72 counties were represented, and our 6 resolutions that I had brought in all got passed.
So is this our legislative update then?
I guess.
Okay, just wanted to double check. Yeah. Okay, an update on the ADRC commercial kitchen project.
I have no new update on that.
Okay,
Status
so can I ask a question, Mo? So it's my understanding that there's going to be a test case ran or a kind of a trial run or a test of how feasible and workable this is. Is there any time frame of when that may happen?
Not at this time. I have the
Yeah.
director of ADRC working with the director of GAM on those issues and the
Okay.
licensing. And then also Nicole at ADRC is doing a deep dive into the budget and the specifics of the food program for our costs for Polk County.
Okay, thank you. And I'll talk to her at ADRC. Okay, update regarding housing.
Housing, we still do not have any new applications in. The one was sent out to Balsam Lake, Village of Balsam Lake, but we have not had it returned yet.
Okay. Good to know. 16, our communicable disease report, Helen?
Sure, the water advisory that was issued for Loveless Lake due to blue-green algae at the beginning of September was lifted last Friday, so that's good news. Respiratory disease activity for Polk County, so that includes COVID, flu, and RSV is right now minimal and stable. Although we are moving into respiratory season, so the county is giving out flu shots on Tuesdays if you would or need to get your flu shot here. Measles, as of October 7th, Wisconsin has 36 cases of confirmed measles. 100% is in unvaccinated individuals. Good news, the last new case was reported on September 7th. So, and then nationwide, as of October 8th, there's been 1,563 confirmed cases, still with 3 deaths. So.
Okay, thank you, Helen. Johnny, did you have anything to add for
I
legislation?
guess the only thing I'd add to that, Dr. Moe, is the governor did put money in his budget for increased judges, and so you just keep on hounding them for that and to get that money to come up to our part of Wisconsin. Up deal.
Good to know. Thanks, John. Our November meeting date and time, we have previously discussed this, but let's review that because of the change in the county board meeting date.
It's November 4th, right?
Yeah, I'm gonna pull up my calendar.
Be able to attend.
Yeah, so that is November 4th. Or 9 a.m. Okay, so everybody get that in your calendar. Subject matters for the next meeting. This is where we can talk about a resolution, if that is what everybody wants. Also in November, I think we were going to be ready to discuss the alcohol compliance checks or not. Oh, we're not.
We
Okay.
lost our, what do we call them? Helpers. Our kids.
Yeah, our
Testers.
volunteers, we had some volunteers and then he went back to school and we are looking for people aged 18 to 19 to do checks for us, so.
Okay, so where does that go from there then?
So we could move that back.
To, yeah, okay. Yeah, no worries. Okay, anything else that anybody wants on the agenda?
Okay, the agenda says it's at GAM. Are we at GAM for November?
We can ask Dana.
That's a good question.
Just, it just says it right here.
Yeah.
Golden Age Manor.
I thought we
Golden
like
Age.
to,
Golden Age Manor and Amory.
I thought we like to meet there in December because they always have so many Christmas goodies.
Here it is.
I don't know if you guys can hear me.
I know where we're going.
Yeah. Yeah.
Can you guys hear me?
Yes, yes.
Sorry, this is Dana. Yeah, you guys are welcome, whatever works best. Just let me know. We can host either month.
December would be better.
December again.
Let's do December. Yeah.
Okay.
Sounds good. Okay,
For the resolution, what do you want the item number to say? Karen probably has that question. Maybe can we clarify that?
yeah, just, I don't know, consideration and possible action, resolution. Mo and Joe and Brad are going to be working on that and titling it, so they can assign the number and give the title to Karen for the agenda.
Just send it to the county clerk.
Yeah. Okay.
I believe there's one more chance to do technical amendments to the budget, just because of the timing. We should have met last week
Okay.
to be able to run it through Gen Gov, but we missed that opportunity. So Mo and I talked about that there would be one last chance to get it through Gen Gov next time, if there is something for this committee.
Okay,
This year.
so that's something else we'll carry over. We're also going to carry over our further work on reviewing the public nuisance ordinance. Hopefully, maybe we can get that wrapped up. We did pretty good today. So, yeah, carry that forward. Do we have anything else? Just kind of our standard things? Okay,
Motion to adjourn.
Second.
okay, we are adjourned.
I'll turn it in the clerk's office.